Well, this is worrying. Nearly half of NHS workers are now spending time looking for jobs outside the health service, according to some new analysis.
And the Prime Minister says not tackling the huge waiting lists are one of his biggest failures in office.
Although he will cling to this, figures just released show the waiting list for routine hospital treatment, in England at least, has fallen for the 5th month in a row.
So how do we reform the NHS? Joining us now is Senior Clinical Lecturer at University of Exeter Medical School, Bharat Pankani, and Communications Manager at Ladies of Liberty, Jess Gill. Good morning to you both. If I could start with you, Bharat. How do we fix the NHS, and is there any good news?
Oh, the NHS is one of the best in the world if only we would, manage it right and fund it right. So how do you fix it? The first thing is this: medicine costs money. And if you were to invest, and we have not invested in public health preventative measures, then you create fewer patients. Although this preventative action takes about 20 years to grow to fruition, it is the best solution possible, because when you have a healthy population, they go to work, and when they go to work, they pay taxes, and when they pay taxes, they contribute to the exchequer. Therefore, having a healthy population should be very important, and therefore you do your preventative medicine. Going forward, the NHS, most people don't know this, that further to the private finance initiatives, we are bleeding a lot of money to these. We are mortgaged out of existence to these private companies who own the hospital buildings, to whom we have to pay a colossal amount of our money because of those PFI initiatives. And what we can do about what those initiatives are, I don't know. The one other bit that we must do also is, of course, we have these artificial barriers called the purchaser-provider split, which is trusts compete with themselves to provide services. Instead of competing, it is better to work collaboratively. We are not a chain of supermarkets competing with each other, and therefore it is better to say we will work together to produce the best for our country, for all the patients all over the country. There are a few more things I would say, but I'll break for now.
Go on, thank you, Jess. What do you think? Where are we at with the NHS?
I'm sorry, but it's absolute nonsense that the NHS is underfunded. The UK, I believe, is the 6th highest healthcare spending out of all the OECD countries. It's consistently rising. This idea that there's this elaborate scheme that the Tories are trying to underfund the NHS to privacy is a conspiracy theory, and it shouldn't be taken seriously. It's an absolute joke.
Look at it yourself. If you look at all the fellow European Union countries, Germany, France,
Italy, Spain. We're 6th highest out of 32 countries. I think it's an actual...
As a product of GDP, we invest less.
Let Jess finish, Barrett, because you did have your say. Jess, I mean, is he saying that you're wrong? Are we spending more than other countries?
We're the 6th highest out of 32 other countries. It's a product of the system. It's a system that's wrong. I wish that healthcare companies acted like Tesco and Asda. That would actually produce a better product if we treated patients like consumers. I think then we have a healthcare system that prioritises the patients, prioritises the people. You know, during the COVID pandemic, we were told to protect the NHS. Why doesn't our healthcare system protect us? I think we completely need to change our mentality around the NHS, because quite frankly, it's a cult mentality. The NHS needs to be abolished.
Listen, we really want to carry this on, but we've got to take a quick break for the news. If you don't mind, we're just going to ask you to hang on for a minute, because we do have to take a news break. And I know the NHS is incredibly important to our viewers. So, Alex Burkle, first of all, has the weather. Back in a minute.
10:07, you're with Britain's Newsroom on GB News with Andrew Pearce and Bev Turner. We're going to go back to that debate on the NHS. Joining us now is the Senior Clinical Lecturer at University of Exeter Medical School, Bharat Pankani, and Communications Manager at Ladies of Liberty's Jess Gill. We left you two arguing about how much money's being spent, but let's move away from the money. It does need reforming, doesn't it, Bharat? The way services are delivered. Even Wes Streeting, the Shadow Health Secretary, the other day was saying can't carry on the way it is, and he was floating the idea of much more private sector involvement in the delivery of some services.
Okay, let me take that thread up. we can always do better. That doesn't necessarily mean that private competitors are going to be better, because what private competitors do is they cherry pick. They want to do the easy money earner procedures, the endoscopies, the knee replacements, the hip replacements, etc. What they do not want to do, and they will not touch, are the renal transplants, the heart transplants, the ITU, the chronic diseases, the ones that cost a lot of money. So just to say, we've got competition from the private sector, therefore all will be well, is a mistake. It's a huge mistake. And what that does is it takes money out of the NHS system. So when you are paying the private sector for those knee, hip replacements, etc., that money, which could have gone into the NHS pot, goes out. And therefore, when you want to repair your buildings, you want to have an assistant for blood samples, you want lab assistants, you want radiography, etc., you haven't got that money. So it is a misnomer. The other thing that we must do, is those reforms are important, but the reforms are, we need a healthier population, and we need to stop wasting money. We do waste a lot of money on management. We waste a lot of money on people, what we would say, commissioning services. It's a paper exercise. Millions and millions of pounds are spent on commissioning, whereas you know that the trust does this, the trust works with other trusts, and you find the best place to deliver that, rather than a commissioner sitting in an office saying, I'm going to buy 100 knee replacements from you.
OK. Jess, what do you make of that? The other thing we've not really brought into this is a lot of money that seems to be being spent in the NHS at the moment is for new digital systems, technological advancements, and maybe we need more human beings.
Well,
I mean, personally, I think
sorry, let's just let Jess come in. Go on, Jess.
I mean, I think it's best that we let the market decide what is needed. Personally, I think one individual person or a group of people aren't able to decide the entire healthcare system of a country. The issue is centralisation. The issue is bad economic planning. You can't have economic calculation. You can't have a properly efficient allocation of resources when you have a centralised socialist system. And we can look to loads of other different examples around the world. Australia, there's the Nordic models, Germany, all these different countries have different types of healthcare systems, and they perform way better than the NHS. I think, honestly, if you care about people, if you care about patients, if you care about the workers in the NHS, if you care about the taxpayer who is forced to fund this immoral system, then you would want to get rid of the NHS and replace it with something a lot more privatised.
Why is it immoral, Jess?
Yeah.
I think it's immoral to force people to fund a system which they don't have a lot of choice in. Yeah, sure, it might be free at the point of use, but what's the point of it being free at the point of use if no one can use it because the waiting list is so long? I think that's immoral. I think people should have autonomy over their body and autonomy over their healthcare. I think it's immoral to say that you have to fund the system, especially the working class has to fund this system, and they don't have many other options as well. And they have to use their tax money to that, which could go towards private systems, which would serve them, which would treat them as consumers instead of just being a cog on the waiting list. I think that would be a more moral system. I think we should put Nye Bevan up there with the rest of the socialist dictators like Chairman Mao and Stalin, quite frankly.
Go on, Barrett, you're shaking your head vociferously there.
Look, the simple answer is as follows. Poor people die as a result of not receiving health care. In America, people are either bankrupted or they die. It's as simple as that, right? Health care is one of those things that a civilized nation can provide for its population, and it can provide it pretty well if they put their mind to it. I would like to take part in reforming the NHS. I feel we've had several secretaries of state who haven't had a handle on health and healthcare matters, and they've fiddled. And things started to go drastically wrong when we did all these PFIs, and then we had the Andrew Lonsley reforms, which has decimated public health. And I tell you, public health is the one that creates fewer patients. And if you've got fewer patients, then your money goes further. we've got the PFI fiasco, and I don't know how you would get out of it. So there are a lot of things you can do. You were mentioning IT. Well, of course, we need IT to help us, not overtake us. Unfortunately, with mega IT projects in the NHS, there have been failures. And of course, we mustn't have another IT failure. So we had Fujitsu working on IT systems for the UK, and they wasted billions of pounds, and then the project was scrapped. It's that sort of waste that we should, of course, reform and not spend.
And you probably agree with that, Jess, wouldn't you?
Yeah, absolutely. I think we should try and make use of the taxpayers' money as efficient. Can I quickly respond on the American thing? Because for one, I'm not advocating for an American system. There are plenty of other examples, like I mentioned, with the Nordic model, for example. But to the issue with the American system is actually like government regulation, like the American Medical Association and the FDA lobbying the government, making it unaffordable for consumers. Again, the issue goes to the free markets. And I think if you genuinely care about people, you would be for free market healthcare.
So, Bharat, you obviously don't care about people because you think this should be partly taxpayer funded.
It's the most efficient way to look after the majority of the population, the National Health Service. It does a great job. There's one other item I would like to share with you, is this. There is a disconnect between our hospital sector and our healthcare sector in the community, i.e. care homes. A huge disconnect. And we pay a lot of money, or people pay a lot of money to care homes to look after their frail and elderly parents, etc. Now, we need to address this elephant in the room, which is that care home sector is privately run, and it is a law unto itself. So if they don't want to readmit a patient stays in the hospital. The patient stays in the hospital, the bed is blocked. The bed is blocked, we can't do your knee, hip replacement, etc. And therein is a huge problem of discharges. And that can be addressed very quickly if you put your mind to it, if you've got a handle on what the issues are.
And it very much seems that those in power subsequently over many decades don't seem to have had a handle on that. Thank you so much, Ladies of Liberty Communications Manager Jess Gill and Senior Lecturer at the University of Exeter Medical School, Bharat Pankhania. Thank you for your extra time as well this morning, both of you.
I would take issue with Jess describing Anara and Bevan, putting Bevan in the same pantheon of hideous people like Stalin and Chairman Mao. He was a very good man.
I love the fact that she comes out swinging, though.
Yeah.
She believes in what she's saying. Right, listen.